Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a series of lectures on your heart. The feature presentation is a nuclear stress test, a virtual tour. If you have been ordered a nuclear stress test, I'm going to walk you through exactly what are the things that you need to focus upon, what is going to happen in the laboratory, and how we process the images and how we interpret the results and make a decision. So let us take this virtual tour. As you can see, the nuclear stress test consists of two components, namely the stress test, where you walk on a treadmill or we get a chemically induced stress, combined with the nuclear images of your heart to give two different parameters, namely the electrocardiographic changes on a treadmill along with the myocardial perfusion or blood supply to the different regions of the heart muscle. It is a very simple test, but it is pretty complex. It is a whole specialty by itself. People spend their entire life studying and perfecting this nuclear stress test involved in the evaluation of patients with chest pain. And here is a video I did almost more than 10 years ago when I had a nuclear camera in my office. You can go and watch this video on my YouTube channel, which has a lot of useful information. I'm going to get you an updated information about the basis of nuclear stress test and how we do it, so you get a virtual tour. The concept is based on the fact that the isotope, namely the technetium M99, when it is injected into the vein, the technetium is picked up by the heart muscle. As you can see, we have the right heart here, we have the left heart. You can follow my arrow. We have the right heart here, we have the left ventricle. This is looking from different angles. This is looking from the front of the chest. This is horizontal. The heart is sitting almost like this, and we are looking through the heart like this. And whereas this is the vertical one, as you can see, the vertical is going from the front to the back. This is like short axis cutting slices of pear. Anyway, we can see this is the anterior wall. This is corresponding to this. This is the septum. This is the inferior wall, and this is the lateral wall. And looking at in a horizontal, where it is going from the front to the back, it is this is the septum, the apex, and the lateral wall. And when it's going vertically through like slices going through like this, then we have the anterior wall and the inferior wall. And the isotope is very well protected, and we have to have very strict radiation guidelines in order to be certified to perform a nuclear stress test. And as I told you at the beginning, it consists of two components: the complete stress test along with the monitoring of your heart rate, rhythm, EKG, blood pressure, and your vital signs. And that is followed by injection of the isotope and taking heart images. The whole process is going to take you 4 to 5 hours in the office. When you come in, you fill out your registration forms. After that, we set up an intravenous line. Then you go through the resting images to start with, which takes about 15-20 minutes. Then you go through the stress part, be it on a treadmill or by using a chemical to induce your heart circulation changes. Then we take a second image after the completion of the stress part. And here's like a roadmap of what we exactly do. When you come in, we start an IV. We get resting images. After that, your exercise on the treadmill. At peak exercise, we inject the isotope here, and you get the isotope, the resting dose, before we take the resting images. So the isotope is injected, you take rest for 5 minutes, then we take the second set of images following the exercise part. Then we combine these two images to look for any variations in the circulation to the heart muscle. And then we sit down and look at the information on multiple monitors where we can process the images and do changes and do the calculations, and also we can generate the report from the same computers. And here is looking at the heart function, and as you can see, there's the myocardial imaging, and this is actually a CAT scan, but nonetheless, this is how a heart is sliced. As I said, we have the anterior wall and the septum, the inferior wall and the lateral wall, and the whole heart going from this is the short axis going like slices through a pear, and this is going like horizontally. Then we make 17 different segments going from the tip to the base, and it is shown like a target. And that will tell us about which segment of the heart muscle is not getting adequate blood supply, which segment of the heart muscle is having poor circulation, which segment of the heart muscle is a scar, or which segment of the heart muscle is normal. Like as you can see, the entire myocardium here is lighted up. That means this is a normal image. This is a normal image. This is a normal image. But if you look at this one, there is a defect here. This is a missing part. There's a missing part here. This is a missing part that is towards the apex. That is towards the apex and the apical segments, as you can see here. So that's how we find out where is the defect. Is the defect reversible or is it fixed? And also look at the overall function of the heart. And here's an image which is showing the target which I was talking about. And this is a defect. We look at all this. This is the stress image. This is the stress image looking at the perfusion, and this is the rest image. You can see a difference between the stress image and the rest image. This involves the infromedial aspect of the heart, the segment, infroseptal. Then we have a bigger defect here compared to a minimal defect here. That means there is a critical stenosis supplying this region of the heart muscle, which is most often related to the blockage of the right coronary artery. So this is how we deduct the location of the artery, the extent of the defect, and also determine whether this defect is like a scar from an old heart attack, or whether the defect is due to critical stenosis in the coronary artery. This is just looking at from a different way, and as you can see, the size of this was involving like almost 1/3 of the pie, that is almost 30% of the myocardium, and most of it is reversed. That means this person has a critical stenosis in the right coronary artery, and by opening up, we can dramatically improve the circulation to this heart muscle. Okay, let's continue with this. And here is an example of another myocardial scan. As you can see, the stress image looks pretty clean. That means this is a normal stress response nuclear study. Then you get a nuclear reports here, and this is in addition to the report, we look at the images. As I said, we look for any evidence of reduced circulation. Then we determine, is this a scar or is this a reversible ischemia? We determine the extent of the myocardium involved, like 10%, 20%, 30%. In the example we saw, it was close to 30%. Then we determine how much of that is reversible. Sometimes you can have a fixed defect with some reversible changes. A whole different number of combinations can happen. We look at the overall function of the heart, which is known as the ejection fraction. And based on that, we conclude the decision. Then we conclude and decide whether the patient needs to have a cardiac catheterization and possible stent placement, or whether the patient needs to be treated with medications for the time being. And if the stress test is normal, we can say with certainty that the chances of this person having any critical stenosis is less than 95 to 97%. That means if you have a normal nuclear myocardial perfusion studies with a normal ejection fraction, the chances of someone having critical stenosis is less than 5%. So that should be the good note. So I'm going to end on that good note. I am Dr. Nik Nikam, a cardiologist, and we have been talking about nuclear stress test, a virtual visit. I have a series of lectures on heart health. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next video.